Okay. Good afternoon. How are you today?
I'm okay.
Okay. I'm Alexis. I'll be your student nurse. Can you verify your name and date of birth for me?
Jeanette Hart, level 2370.
Okay. And what brings you in today?
I hurt my wrist
Okay. When did you do that?
Thursday.
Okay. Can you show me exactly where it's hurting at?
Yeah.
Okay. And on a scale of 0 to 10, can you rate your pain for me?
6.
6. Okay. And does what makes it better and what makes it worse? The pain.
Just hitting it, pressure on it.
Okay. And how does this affect your daily life, or does it affect your daily life?
Only when I'm working.
Okay. All right. I'm gonna assess your vital signs, starting off by getting your blood pressure. Okay. If you have your feet flat on the floor for me. Yeah, I see your arm. Okay, you can rest that on. All right. Blood pressure looks good. 130/70. Okay. I'm gonna assess that your heart rate. All right. The heart rate rhythm is good, showing good pulsation there. Respiration rates are also good, showing regular. Okay. Next, I'm gonna check your level of consciousness, your orientation. All right. Patient does appear awake and alert. Is talking to me. Can you tell me where we are?
Yes.
Can you tell me the date?
10/31.
Okay. And do you know who our current president is? So, okay. Patient is awake, alert, oriented ×4. Did you come by yourself or did you come with someone today?
With someone.
With someone. Okay, so patient does have a support system. Speaks clear English and intelligible. Mood is good. Patient is cooperative. Okay, I'm gonna check those pupils there for you. Okay, you just look straight ahead. Okay, pupils are equal, round, and reactive to light. I'm gonna go ahead and check your jugular vein as well while I have my light out. Okay, no jugular vein distension. All right, I'm gonna go ahead and listen to your lungs next, but first let's assess that skin. Skin color looks good. For ethnicity, don't see any lesions or wounds, no drains. I'm using pull up your sleeve here. I'm so sorry. Pull up your sleeve there. I'm going to use the dorsal side of my hands to check the moisture and the temperature, which is warm and dry. I'm going to check that turgor here. Brush your hands. All right, turgor is resilient. All right, next up, I'm going to go ahead and check your lungs. Just breathe normally for me. I'm going to use, every time I use the diaphragm of my stethoscope, when I move it, just take a deep breath in and out, okay? Have you been experiencing any cough lately?
No.
Okay. I do notice that you're sitting upright and straight, not hunched over or using any extra muscles to breathe, which is a good sign. Okay, I'm going to check 6 positions here on the front, bilaterally. Yeah. And we're going to do the same thing anteriorly, okay? With each time you feel my stethoscope, just take a deep breath in and out. Okay. All right, breathing is unlabored, no extra wheezing or crackle sounds heard. Okay, I've already checked your jugular vein distension, but next I'm going to listen to your heart using the bell and the diaphragm of my stethoscope. I'm checking for any murmurs, any bruit of that nature, and those regular S1 and S2 sounds, okay? All right, I'm going to start here at your aortic, pulmonic, Erb's point, tricuspid, and mitral. Same thing with the bell of my stethoscope. Alright. Normal S1 and S2 sounds were heard. No bruise, no murmuring going on, which is a good sign. Alright, next I'm going to check your pulses bilaterally, starting here at your radial pulses. Turn your hands over. Alright, 2+, good and strong. Same thing at your dorsal pedis. You rest your arms. Okay, 2+ there. Here I'm going to check the capillary refills on those toes. Should be 2 seconds or less. And then on those fingers, same thing, 2 seconds or less. All right, good capillary refill in both your hands, your fingers, and your toes. All right, next I'm going to assess for any edema. I'm checking that bilaterally. Okay, there is some pitting edema noted here. It's about 1+, and a little discoloration in those feet. Get a little purple and blue. Okay, I'm going to assess your abdomen. When was your last bowel movement?
This morning.
This morning, okay. How was it? Was it regular? Did you have any constipation, any diarrhea?
Regular.
Okay, was it painful to do so?
No.
Okay, and when did you urinate as well?
Yes.
Okay, what color was that?
Dark yellow.
Dark yellow. Okay, and was it painful?
No.
Any blood or anything in there? Okay, good. Any hesitation with urinating? Trouble? Okay, good. Do you experience any nausea or vomiting? Any trouble swallowing?
No.
Okay, good. All right, I'm going to get you to lay down on the floor for me. I'm going to assess your abdomen. Okay. So I'm checking that for that skin color, for symmetry, for contour, any distensions or any wounds or lesions. Color looks good. For ethnicity, contour, checking profile view, and down here. And while I'm down here, I'm also assessing the pulsation of that aorta here, which is noted. Umbilicus is midline, and it's inverted. Okay, distensions. All right, next I'm going to listen to your vowel sounds, starting at the right lower quadrant, working my way around till I reach that left lower quadrant. Listen for about a minute in each one. Should hear sounds 5 to 15 seconds. If I don't hear a sound in that, I'm going to remain in that quadrant for about 5 minutes. And at the end, notating if there was sounds heard or if it was normal, hypo, or hyperactive, okay? Normal vowel sounds were heard in each quadrant. And next I'm going to lightly palpate each quadrant, checking for any tenderness or pain. You just let me know if you do feel some, okay? Okay, next I'm going to deeply palpate. Same thing, let me know if you feel any tenderness or pain. little pain there.
Just a
Little pain. Okay. So I'm gonna document that there's a little tenderness in that left lower quadrant. Otherwise, there are no masses or tenderness or pain in any other quadrant along with those normal vowel sounds. Okay, I'm also going to palpate that bladder area. I should not feel that bladder, seeing as though you said you did void before we started this assessment. Okay, while we are here, I'm going to assess those lower extremities, checking for range of motion and muscle strength. Have you been experiencing any pain or tingling, numbness in any of your extremities?
No.
Okay.
Just a little swelling in my right knee.
Just a little swelling in your right knee? Okay. All right. Lift that leg up for me. Bend that knee. Okay. Flex that foot up and down and wiggle those toes. Okay. Same thing on this side. Extend. Okay. Bend the knee. Okay. Wiggle that. Extend that foot and flex that foot. Wiggle those toes. Okay. Good range of motion. Any pain while doing any of that?
No.
Okay. All right. Next, I'm going to assess that muscle strength. Okay. Just have you to lift up those legs at the same time. I'm going to push down on it. Don't let me push it.
Okay.
Okay. Okay. Good. Same thing with your feet. Okay. Good. Okay.
Nose is itching.
Okay. All right. I'm going to go ahead and get you to sit up. I'm going to check the upper extremities.
My nose is itching.
All right. So go ahead and lift both of your arms up for me. Okay, and extend them to your side. And bring them back in front of you. All right, no crepitus felt there. Same thing with your elbows. Flex and extend them. Okay, and then in your wrists. I know you have a little pain there, so if you just flex and extend it, tell me if you have any pain while you do that. Rotate them for me. Any pain in that? Okay, and wiggle your fingers. Okay, good. All right, if you extend your arms, we're going to check that muscle strength. And don't let me push down on them. Don't let me push in on them. And don't let me push out. All right, good. All right, so patient does not have trouble ambulating, or we were able to get down here on the floor, which is good. All right, I'm going to complete hand hygiene and document all of my findings.